Aloha, I'm Dr. Catherine Taketa-Wong. My mission is to heal the sick, not just to give them pills to take for the rest of their lives. As a naturopathic doctor, I can write prescriptions for drugs, but I would rather write them for herbs and healing foods. As a Chinese medicine expert, I can employ a whole different approach to health that complements our Western system. And as a healer, my mission is to educate and empower as many people as I possibly can about how to become healthier and happier. Happy people, happy world. My specialty is the medical treatment of autism, ADHD, and other special needs. And I also treat some of the toughest adult conditions. So I don't take new patients without a phone consultation. The contact information is on our Facebook page. At today's event, I'm going to talk with you about some of the alternatives to pharmaceutical medications, including supplements and Chinese herbs, and show you some products that you can purchase. I encourage you to visit the online store I founded so that you can make a difference for special needs children with every purchase. There is a 20% discount, and 100% of my store's proceeds goes towards helping children with special needs and their families with the cost of their treatment. The store is on our website at drtaketa-wong.com. That's drtaketa-wong.com. Let's get started. I'm going to be talking about side effects during this event. What do I mean by side effects? Officially, the World Health Organization says that they are any unintended effect of a pharmaceutical drug at a normal dose. Our own National Institutes of Health says that they are, quote, secondary or unwanted or unintended effects of a therapy, end quote. So someone takes a medication for a UTI, a urinary tract infection. The purpose of the drug is to kill the bacteria that's causing the infection. That's in our gut and cause diarrhea and nausea, rashes, dizziness, yeast infections. But unless the person knows how to counteract those side effects of that drug, that is often what happens with antibiotics. Those are secondary or unwanted effects. Unfortunately, for the most part, conventional medical schools don't train doctors on how to counteract of these drugs. But, and this is important, there are times when a patient's condition calls for a pharmaceutical drug, and in that case, I don't hesitate to prescribe it. The difference is I also explain the side effects and let the patients know how to counteract them wherever possible with natural remedies so that their antibiotic, for example, won't cause diarrhea. So these are some differences in terms of the naturopathic approach, really looking at how can we minimize all these side effects. And many people don't realize that often there are natural remedies that can be very effective for many different conditions. And so I will always try to use these natural remedies as much as possible before I get to having to use a pharmaceutical. Pharmaceuticals are really my last resort. I try to use food, nutrition, herbs, vitamins, other nutrients that oftentimes can be very effective and sometimes just as much, or in some cases even more effective than the pharmaceutical medication. Now, first I want to talk about a condition that affects 60 million of us at least once a month, and 50 million people experience every single day. I'm talking about heartburn. But before I show you a natural medicine alternative to conventional pharmaceutical drugs, I want to emphasize that my go-to recommendation to my patients for conditions like heartburn, conditions that are often food-related, is to feed their body more of what it was built for. Think of the foods your grandparents or great-grandparents ate. They didn't have highly processed manufactured food with all the refined added sugars and preservatives and artificial flavors and colors. They didn't have fast food restaurants. They cooked from scratch. So many of these conditions, like heartburn, are really a product of all of the fast food and these highly processed foods that our body really wasn't made to digest. So that is my first recommendation when I'm working with patients that were having heartburn, really looking at what can they change in their diet, or what is in their food, or the timing of their food and their eating, so that we can try to. That being said, I don't know anyone who's perfect, and if you have heartburn, supplements are usually a far better choice than pharmaceuticals. Why is that? Because of the side effects. To begin with, certain acid blocker medications actually are associated with an increased risk of developing dementia. Second, we actually need normal levels of stomach acid to be able to digest our food. In the long run, when you take an acid blocking medication and decrease the amount of acid in your stomach, it can cause problems in digesting what we've eaten. Also, stomach acid helps to kill bacteria that could make us sick. If we don't have the normal stomach acid that we need because we're taking acid blocker medications, we're more likely to get sick from the food we eat due to possible bacteria, parasites, or other organisms that could make us sick. Of an iron, so that we can taking an acid blocker medication can increase the risk for developing deficiencies of vitamin B12 and iron. Lastly, acid blockers increase the risk of an intestinal condition that can cause diarrhea, abdominal pain, gas, bloating, and constipation. Whenever possible, and that's 90% of the time, I want to help my patients avoid side effects. What I often prescribe for them is a digestive enzyme supplement called Critical Digestion. I'm going to share my screen and show a picture of that over here. Let me see. I may not be able to actually do a screen share with this one, so I apologize. I will go ahead and we can put the names of some of these products in our post, and so that we can be able to share it with you. All these supplements are available through our online supplement store. So we can go ahead and then you can get them through those supplement store, and then we can put the names of the products. So what I prescribe is a digestive enzyme supplement called Critical Digestion. The enzymes are made from plants and are all natural. People sometimes have difficulty breaking down the foods that are causing the reflux. Enzymes help break down the food so we're less likely to have reflux. It's a natural medicine, so there are rarely any side effects. I also prescribe aloe gel with honey instead of taking antacid tablets or drugs. It provides immediate relief for that burning feeling and is actually good for us. Please remember, you can purchase the supplements and herbs I'm discussing at the online store I founded as a fundraiser for treating special needs children. It's at our website at drtaketa-wong.com. I find that people do call and talk with me after viewing a video or two, visiting our website, and some do become patients. If you'd like, you can schedule a no-charge phone consultation with me. All of the contact information is on our Facebook page. Getting back to some of the natural remedies versus pharmaceuticals. One of the reasons that pharmaceuticals come with so many side effects is that the concentration of the active ingredients are much higher than in many natural remedies. Drugs typically are developed from synthetic chemicals. Natural remedies, rather than isolating and concentrating a particular ingredient, combine different plant-based compounds that work together. For example, Chinese herbal formulas have been refined over thousands of years. Their blend of natural ingredients all work together and have been proven to be highly effective. Another common condition today is high blood pressure. There are 3 different common medications that are used to lower blood pressure. There's other classes of drugs, but I'm going to talk about 3 of some of the most common ones and their side effects. The diuretic blood pressure drugs increase the frequency and urgency of urination and can cause muscle cramps and even gout. Beta blockers, like atenolol or propranolol, slow the heart rate, so the most common side effect is feeling tired and short of breath. Others include dizziness, cold hands and feet, and diarrhea. Lastly, ACE inhibitors like lisinopril can cause a dry cough, headaches, and loss of taste. My patients appreciate having remedies without side effects, so whenever possible and medically indicated, I prescribe Bromolfia Extra, which is a blend of herbs with vitamins and minerals. The supplement helps to calm the fight or flight response in order to lower blood pressure, except when the blood pressure is extremely high. And in those cases, I typically will prescribe a pharmaceutical to get the blood pressure down and then work with the patient to address the underlying causes so that we eventually can try to wean them off of the medication. For high cholesterol, the go-to pharmaceutical is a statin medication. Again, because it's so concentrated, statins often come with significant side effects like muscle pain. And statins also can lead to muscle breakdown. That's typically why they cause muscle pain and aches. Headaches are common, as well as constipation, diarrhea, and gas. Statins can also cause liver damage due to inflammation. That leads to our liver not working as well as it should to break down hormones, remove toxins, and regulate blood sugar. Instead of statins, I typically prescribe a number of different natural remedies. I often will use magnesium. I also, if the cholesterol is very high, I often will prescribe something called red yeast rice. One of its compounds is monocolin K, the same ingredient that is used in lovastatin or most statin drugs, which is a cholesterol-lowering drug. But because we are using the whole plant instead of a super high concentration of the active ingredient, side effects are rare. I recommend the Jarrow brand, which also has CoQ10, which is an antioxidant that's important for heart health. CoQ10 is also lowered by many of the statins, and so giving CoQ10 can help to replenish that if you are taking a statin. Urinary tract infections are treated conventionally with antibiotics, which can cause diarrhea, intestinal cramps, bloating, and gas. They also kill our good bacteria along with the bad, which disrupts our gut and interferes with the production of neurotransmitters for our brain. If you're interested in all the damage that they can do, just check their side effects on a trusted medical site. While antibiotics are valuable for acute infections, we don't always need them when natural remedies can work just as well. One of the natural remedies that I often use is called urinary tract formula from Wise Woman Herbals. Another supplement is D-mannose from Pure Encapsulations. I recommend that patients choose the powder form instead of capsules because when we have an acute UTI, we would have to take a day to have a therapeutic effect. With the powder, you can just take 1 scoop once a day. So I typically recommend the D-mannose powder in acute infections. Ear infections are also typically treated with antibiotics. As a mom with 2 boys, I've seen my share of ear infections, also in a number of patients, but with my children, infections. Instead, I prescribe garlic mullein oil. Mullein is a plant, and the oil from it is very soothing, which helps soothe those inflamed, painful ears. You can put just a few drops in the ear, and garlic also has antimicrobial properties that helps to kill the bacteria. We're approaching the cold and flu season, and we're going to see a lot of ads for over-the-counter cold and flu products. Nothing to kill the viruses that causes our cold and flu. They only cover up the symptoms. But why do we have the symptoms in the first place? It's because our immune system is trying to kill the infection. And many of the over-the-counter remedies actually counteract our body's immune system in its efforts to get rid of the virus. For example, the body will try to create a fever to heat up and kill viruses. But drugs like Tylenol and ibuprofen lower the fever. So when people are actually taking ibuprofen and Tylenol, studies have found that when we do that, it can sometimes actually prolong the infection because our body is trying to heat up to kill the virus, and we're just shutting down that heat. And then it can take longer to be able to clear the virus out of our system. Sure, you can temporarily feel better when you take Tylenol and ibuprofen because you don't have the fever, but in the long run, it can actually hamper our body's ability to get better. Also, when we have a cold or flu, we're told to use decongestants to dry up the mucus, right? We don't like having that feeling of my nose is stuck and it's congested. It's annoying. Sometimes it can be hard to breathe. But why does our body make mucus? It's because it's trying to trap the virus in that sticky substance so that when we blow our nose, we get the virus out of our body. It's the same with when you have mucus in your throat that you cough up. We have mucus that goes through our lungs and is trying to trap the viruses that could be in our lungs, and then we cough it out. So again, it's our body's ability to try to get the virus out. It's also the same with cough suppressants when we have a cold. When we cough, our body is trying to forcefully push out the virus from our body. The over-the-counter ability to get the virus out. Now, I typically recommend using these pharmaceutical remedies only if they are making it very difficult for you to be able to heal. Because, for example, if you're having a cough that's so bad, you're having rib pain and you can't sleep because of the cough, I may recommend using a low dose of a cough suppressant just to help you to be able to sleep, and just during that time. Or if you're so congested you have a hard time breathing, then it may be helpful to use a decongestant temporarily. But by and large, I strongly recommend using natural remedies first, because these natural remedies actually help to kill the virus, support our immune system to help us address the root cause of what you're feeling. I use Throaties tincture, also something called immune glycerite, which can help directly as they come in contact with viruses in the throat. They can directly help to kill them. I also use a number of different Chinese herbal formulas. There's one called Gegantang. There's other ones that I use called Yin Chao San, which can help with killing common cold viruses. There's also Immunotone, which is a blend of herbs that helps to support the immune system as well as kill viruses. I also will use essential oils. This is On Guard by doTERRA, so I'll often use that. I'll have people use it topically, and I will sometimes have people dilute it in some oil or water and then actually take it orally. So those can be helpful in terms of helping with colds and flu. I trust our discussion about alternatives to pharmaceutical medication and over-the-counter drugs has been useful for you. You can find the natural remedies I talked about today at our online store, where all the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video, and you can also find it on our website at drtaketa-wong.com. You're welcome to talk with me personally about any health concerns that you have so that you too can feel empowered with your health. All of the contact information is on our Facebook page. Thank you for being with me. I look forward to seeing you in 2 weeks. Mahalo and aloha.